What comes to mind when you hear Tourette syndrome? How many of you think of the obscene language when you hear the word Tourette's? A verbal tic may be expressed as an obscene word called coprolalia, but only about 1% of people diagnosed with Tourette have this vocal tic, says McNaught and Mink. Unfortunately, the media has portrayed the disorder to appear this way. Even though most Tourette patients will never experience this tic, Tourette is a chronic neurological disorder. There are many treatment methods available for the Tourette, including medication management, cognitive behavior therapy, and supportive therapy. The reason this topic interests me is my son was diagnosed with Tourette syndrome when he was 5 years old, and he is now 16. Over the years, he has had many tics that have lasted from days to years. He has taken many types of medications and gone to many counseling sessions to learn how to cope with this disorder. Let's begin by defining Tourette syndrome. Tourette syndrome, or TS, is a neurological disorder characterized by involuntary repetitive movements and sounds called tics. Tics are uncontrolled urges similar to hiccups or sneezing. A person may not want to hiccup, but he or she is unable to control the hiccup, and eventually it has to come out. Tics are similar in that a person can try to hold back a tic, but eventually he or she will have to tic. So common tics are blinking, throat clearing, head jerking, grunting, and facial grimaces. There are two types of tics, simple and complex. Simple tics involve just a few parts of the body, such as blinking, whereas complex tics usually involve several different parts of the body and can have a pattern. For instance, at one point, my son's complex tic would include looking at his fingers, smelling them, and having to touch his thumb to each finger. Imagine doing this several times a minute and trying to complete homework assignments or read. Pretty difficult, right? Well, TS is diagnosed by doctors when a patient has had an ongoing motor or vocal tic for at least a year. Unfortunately, no blood, lab, or imaging test assist doctors in diagnosing TS. Though diagnosis with Tourette are typical between the ages of 5 and 10 years of age. Tourette is thought to be genetic. However, according to Lynn and Stevenson, as a result of its complexity, scientists are unsure of its origin. TS affects all ethnic groups, but males are 3 times more likely than girls to be affected. According to the National Institute of Neurological Disorders, in the United States, 3 of every 1,000 children between 6 and 17 years of age have been diagnosed with TS. There are many behaviors associated with TS, so let's discuss some of those behaviors. Many people with Tourette's experience other problems, also known as co-occurring conditions, that often cause more problems than the tics themselves. The National Institute of Neurological Disorders says 79% of patients diagnosed with TS also have been diagnosed with at least one additional mental health, behavioral, or developmental condition. The most common behaviors include ADHD, problems with reading, writing, arithmetic, and obsessive-compulsive symptoms. For example, my son not only has Tourette syndrome, but he also suffers from ADHD and OCD. Although this is not uncommon, it is difficult to treat. Some behaviors may be associated to OCD and then repeated by Tourette symptoms. It is not uncommon for him to do impulsive behavior or noise and then later it become a tic. For instance, he might make a squeaky noise at someone in a response while conversing, but he may repeat the noise and later it will result in become a tic. People with TS have often also reported problems with depression and anxiety. Tics can wax and wane and vary in type, frequency, and intensity. However, stress, anxiety, and excitement tend to worsen its occurrence. Although the symptoms of TS are involuntary, their tics involuntary. Some people can sometimes suppress their tics in an effort to minimize the impact on functioning. People with TS often report a buildup in tension when suppressing their tic to the point where they feel that the tic must be expressed. Most people with TS experience a significant decline in motor and vocal tics in late adolescence and early adulthood, but other co-occurring conditions may persist throughout adulthood. There are several treatment methods available for this disorder, so let's examine some of those possible treatment methods. Although there is no cure for TS, there are treatments available to help manage tics. Many people with TS have mild case that do not get in the way of their daily life and therefore do not need any treatment. However, medication and behavioral treatments are available if tics cause pain or interfere with school, work, or social life. Brill states a common class of medications prescribed for TS is neuroleptics, or also known as antipsychotics. These medicines suppress actions of the brain chemical dopamine, which can decrease motor and vocal tics. Another popular anti-tic medication are high blood pressure medicines, which decrease levels of certain chemicals in the blood, thus relaxing the heart. The nicotine patch is also used. However, using this treatment of TS is not for everyone. Brill says 70% of children who have tried the patch complain of skin irritation and nausea. Research is underway to study drugs that act the same way as nicotine in the brain but will not produce the same unwanted side effects. Cognitive behavior intervention is one possible training method commonly used to teach sufferers to voluntarily move in response to a premonitory urge to a tic. This treatment is very difficult if a patient has several tics apparent at one time because they have to learn how to focus on each tic and learn a new response to each. Supportive therapy can help a sufferer learn how to better cope with the disorder and deal with the secondary social and emotional problems that oftentimes occur. My son attended months of cognitive behavior therapy, and despite his efforts to learn and manage his tics, it was unsuccessful. This could be due to the fact that he had many complex tics occurring at the same time during the treatment period. Although he was unsuccessful at managing his tics, he was successful at following behavior charts, which helped reduce his anxiety and stress and change inappropriate learned behaviors. To sum it up, Tourette is a commonly misunderstood neurological disorder. Educating others is an important step in awareness. Although tics exist in severity, most sufferers go on to live normal lives. Many treatment methods are available to help control tics. However, stress and anxiety exacerbate these tics, making it difficult to function in a normal setting. I hope you've gained some knowledge about Tourette syndrome and will be more understanding and cognizant when you encounter people who suffer from this disorder.